When social needs are not being met, it makes it hard to meet a person's mental health needs. I think mental health treatment gives a lot of promise. And so even though we can't undo things that may have happened to patients or predispositions to severe and chronic mental illness, we have a lot of treatment options to change the trajectory of how one lives with those experiences.
I think of health equity as making sure that everybody, regardless of their social, financial, cultural situation, has a similar level of access to healthcare, and that outcomes are based on biological factors, not on social factors. There's still a tremendous stigma around mental health, and it really does prevent a lot of people from seeking the care that they need. And that stigma can be very culturally contextualized, right? So in different communities, how they think about mental health, how they treat mental health, their acceptance of mental health treatment can be very different. So it can be more difficult for some people than others, I think, given their family structure, given their culture, given their community, to seek out the help that they need or to even admit that they need help in the first place.
You know, growing up, that was a shh thing. It's like, no, we're not talking about that. Just tough it out is the kind of mentality I grew up in. There's no need to be ashamed. There is something wrong. Let's go ahead and handle it. And how can we handle it? We bring it forward. We bring it to the light.
It really is critical that we normalize some of these mental health challenges that are so pervasive in our society, and that we really reduce the stigma so that we can increase access to the needed care that people need to get.
One of the things the church can do is to encourage our own people and people everywhere to not see mental distress or mental health distresses as something that is shameful. Mental health is a health issue like any other. And so therefore, you should go and see those who can help you. Our mental, psychological, and therefore even spiritual health is important if we're going to make sure that our bodily health is sound. And Catholic tradition would say a resounding yes to that.
Right now, we are in the midst of a mental health crisis. Particularly during the pandemic, 40% of people in the United States reporting symptoms of anxiety and depression.
If something's messed up psychologically in that part of the soul, well, you better do something about it, because it will no doubt have an effect on even your bodiliness. And your health, as we usually construe health.
We work with a lot of individuals that, were dealing with mental health issues and weren't really prioritizing it. And COVID forced that priority. And the result is the influx of patients that we tend to see that are struggling with mental health.
The pandemic itself has potentially exacerbated social risk factors like things like isolation, lack of connectedness, being able to go to work where your colleagues are, have those personal relationships, being able to go to school.
There was a lot of solitude. I went from working in an office with people to working at home and in my own living room, and it was lonely.
Some research suggests that people who feel more connected to each other, to nature, to themselves, to something bigger than themselves, tend to do better. They don't feel as much anxiety. They don't have as many clinically significant symptoms of anxiety or depression. And so I think it's really, really important, even if we are physically distancing from each other, that we stay socially connected to each other.
Make sure you have a social connectedness, whether that is a friend, a romantic partner, a neighbor. Find an interest that is enjoyable, leisure activities we know that can be helpful in relieving anxiety. Maintain good exercise and self-care.
Body, soul, spirit. All three dimensions of our life are important in Catholic health. I know that they're important in St. Luke's to the various strands of healthcare that St. Luke's brings to their patients and to us in the culture at large. I think the church can help spiritually in this. We try very hard with chaplains and assistant chaplains and using parishes bringing our lay people in to visit the sick, to take care of the marginalized.
There's a lot more options now that there may not have been a couple of years ago to seek help. Telehealth has allowed an expansion of connectedness between patients and their treatment team online. It's not just the relationship between a patient and their provider. Patients can now work with all the team members.
Telemental health allows not only the access for the patient, but it allows the availability with the provider as well to manage time, so we could be a little bit more accessible and available as opposed to in-person sessions.
Our numbers show that more patients are seeing their providers when the option of telehealth is given to them. Patients are more likely to connect with their provider if it doesn't require a physical transportation, parking, walking, time off from work.
Having that option is just a life changer.
Telehealth is in it for the long haul. It was maybe a forced transition, but I think it's going to open up availability to maybe access mental health services and maybe health services in general in a way that's more flexible.
What are the policies that need to be in place? What are the practices that need to be in place? Every stakeholder needs to be at the table in these conversations, including patients and patients from diverse communities, so that they can inform policy discussions, practice discussions, and really sort of improve the entire system.